The most honest and genuine answer I can give about the life of a surgeon is that I don't believe being a surgeon is compatible with life. And that's regardless of your gender and your family status, at least for the kind of life that I want to have. I learned the hard way after doing my surgical training, which went on for many years, and when I had my first job as an attending surgeon, that I really, really, really don't like having a pager that wakes me up at night. I know that sounds dumb, but it's really hard to understand when you're a medical student or even when you're a resident, what that's like year after year after year after year. And you think that it'll get better because people tell you that it will. I also really value time with friends and family, and it's important to me to honor my obligations. So if I say that I'm going to be at a dinner or at a party or at a wedding, I want to be able to be there. And as a surgeon, while there are some times when you really can be there, there's always the possibility that you won't be able to be there. And that is frustrating to me. I also have interests outside of the hospital. I like to bake. I like to do yoga. I like to watch Netflix. I like to do all the normal human things. And when I was working as a full-time surgeon, I couldn't do that. So can you have a family and be a surgeon? Absolutely. All sorts of people do it all the time. And everything that I've said is not gendered. This is just how I feel about the job as a person who's done it. I think you have to ask yourself what kind of life you want to live. How do you want your time to be spent? What do you see your daily life looking like? And by the way, do you want to be getting up early every day? I also am not a morning person, so that turned out to be super annoying. And if you can really be honest with yourself about what it is that you want your life to look like, then you can make an accurate assessment, more or less, about whether surgery is going to fit that life or not.